There's been a renewed focus on ivermectin lately, and in recent months, there's especially been some inaccurate or exaggerated claims around what the drug can do for cancer.
I have 3 friends. All 3 of them had stage 4 cancer. All 3 of them don't have cancer right now at all.
And this comes at a time when a number of legislators across different states are trying to make the drug more accessible to more people. Ivermectin has been around for a while. 2 of the scientists who helped work on the research around its anti-parasitic properties won the Nobel Prize in 2015. But the drug became almost a household name during the pandemic when people looked at this really early preliminary research and thought maybe it could be helpful to treat COVID. But in the years since, there have been a number of studies showing that actually the drug is not effective against COVID. The Food and Drug Administration has approved ivermectin to treat some parasitic infections, and it's also approved to treat skin conditions like rosacea. And it's perhaps most commonly known as a drug for animals that fights parasitic infections. There is very early research into ivermectin and cancer, mostly in animals or in petri dishes. We don't have large clinical trials done in humans, but just because something works in a mouse doesn't mean it will work in a human. So not only has ivermectin not been proven for these other indications, the drug itself also has risks in high doses. It can have these pretty devastating effects on the central nervous system. It can cause people to go into comas. It can lead to seizures. It can even be fatal. And these risks are particularly pressing in children when they're taking these drugs in high doses. So while we don't know yet if ivermectin actually has this benefit for cancer, we do know that definitively there are risks in high doses. And so as one doctor told me, if you're not getting a benefit from the drug, you're really only left with the risks.